Today, my guest is Dr. Nitin Aaron.
Radiology is a branch of medicine which basically uses imaging technology to look inside the body and to make diagnosis of what's going wrong or right.
That a student can follow to pursue this profession.
The way of getting admission into MBBS is through the NEET.
Welcome, viewers, to No Herd Mentality Careers. It's a podcast that deep dives into careers to give you great insights through conversations with people who have been there and done that. Today, my guest is Dr. Nitin Aaron. He is an MBBS and a MD in radiology. He did senior residency in radiology at Batra Hospital, New Delhi. Post that, he has worked in Max Healthcare and Metro Group of Hospitals in Delhi NCR as a consultant radiologist. He joined Sheikh Khalifa Medical City as a specialist radiologist, where he worked for almost 9 years. It is the largest teaching medical center in Abu Dhabi and a leading hospital in the UAE. He then undertook and completed his FRCR, which is Fellowship of Royal College of Radiology, and moved to Boston, UK in 2017, and since then have been working as a consultant radiologist in United Lincolnshire Teaching Hospital NHS Trust. He has almost 25 years of experience in the field of radiology. Please welcome Dr. Nitin Aaron. Thank you so much, Doctor, for joining us today from UK.
Thank you, Ruchika, for having me on your show. It's a pleasure.
Doctor, it is said that radiology is an art of seeing the unseen. And therefore, radiologists are like heroes in disguise because they see what no one else can.
Yeah,
So,
I mean, that's right. So, yeah, basically, radiology is a branch of medicine which basically uses imaging technology to look inside the body and to make diagnosis of what's going wrong or right. So, that is radiology in a nutshell.
yeah, so in fact, that brings me to my first question, which is a very fundamental one. What is radiology, and what are the key aspects of radiology as a career?
Right. So, as I just mentioned, radiology is basically we are using imaging technology to look inside the human body. Radiology branch basically has been there for more than a century. It started in the late 19th century when the X-rays were first discovered. For the first initial 5-6 decades, it was predominantly X-rays based. So to look for fractures, to have chest X-ray, to look for lung pathologies, pneumonia, basically TB that time. I'm talking about early 20th century. That was the role of radiology that time. But especially in the last 3-4 decades, radiology has evolved like I would say no other branch because now we have different imaging investigations like ultrasound, CT scan, MRI. These all are part of radiology. The other investigations would be mammography, nuclear medicine, intervention radiology. So all these come under radiology. And if we talk about today's modern medicine practice, if I'm not wrong or if I'm not over exaggerating, every second or third patient coming to the hospital will have at least some sort of imaging. You come with cough, you have a chest pain, most likely you will have a chest X-ray. You come with suspected injury, you will have an X-ray to look for any fracture. Okay, you're coming with headaches not resolving, you might end up having a CT scan. So nowadays radiology is almost like pathology. Patient, every second or third patient almost will have radiology.
So now that radiology has seeped in so much into our medical diagnostic system, what how does one become a radiologist in India? What is a career path that a student can follow to pursue this profession? If we can start from the subjects that a student needs to take in 11th, and then moving on to the entrance exams and the course that one needs to complete.
Yeah. So basically, to become a radiologist, it's a mandate to do MBBS. Okay. You have to first do MBBS. Okay. And to do MBBS, obviously in school, you should be having biology as a subject. Okay. And then now in India, the the way of getting admission into MBBS is through the NEET examination. So every student aspiring to be a doctor or aspiring to become a radiologist has to undergo this NEET exam, has to secure a seat in MBBS. Okay. Once you have finished your MBBS, which is a core medical training, after that you can choose the different subspecialties in PG, which could be medicine, surgery, gynecology, radiology, anesthesia. But medicine is a MBBS is a must. Once you have done the MBBS, then there is again a competition which is, and NEET is for MBBS. Similarly, you have a entrance examination for the PG. So after MBBS, you give that examination. It's a competition nationwide. Okay. And depending upon your rank, if you've got a rank which meets the requirements, then you can choose the college and radiology branch wherever it is available. So this is how it works.
So in grade 11, is it only biology or is it also important to choose chemistry along with biology?
See, I did my schooling. I mean, I finished my grade 12th in 1994. Okay, so that time, physics, chemistry, bio was a must. Okay, I'm not very sure about what's the trend right now, but I presume it would be the same. So PCB would be required. Okay.
Okay. Okay. And you just mentioned the various subspecialities under radiology, right? Now, these are the potential career paths within radiology. So, how does, if you can again mention all the subspecialities that exist in radiology, and how does one get trained for one of these subspecialities? Like, how do you decide, which one to specialize in?
So what happens is everyone, if they want to subspecialize in a particular branch of radiology, you still need to do the core training of radiology. Okay. So everyone has to first finish the core training of radiology, which in India is what we call MD radiology, which is of 3 years. Okay. So everyone has to do this MD of 3 years, MD radiology of 3 years. After that, so during this 3 years, you would know that what suits you, what interests you. Okay. So the different subspecialties in radiology would be starting from top to bottom: neuroradiology, which is brain, related to brain. Then you have head and neck, face and neck pathologies. Then you have chest imaging, which is chest. You have abdominal imaging, which is for your abdominal part. Then you have musculoskeletal, which deals with bones. You have pediatric radiology, which deals only with pediatric children. Okay. The adults are all separate. Then you can have breast radiology, which is dealing only with breast related issues. You can have nuclear medicine, which, as I mentioned, it's a different, like PET CT scan and bone scans. These are all part of nuclear medicine. That is a different specialty. Then you can have intervention radiology, which is a mixture of radiology with surgical skills. So there are at least 9 to 10 subspecialties within radiology. But first, everyone has to do the basic MD of MD radiology to have the core knowledge. After that, they apply either for a fellowship in whichever hospitals are offering, or you do like a observership or senior residency like what we did. Okay, so this is how it goes. So if you do a fellowship, when I was getting trained in 2000, that time in India the fellowship options were not too many. Okay, but now in the last 20 years, a lot of these options have come up. So if you go for a proper fellowship in which you get a certificate, then you, for example, if I do fellowship in neuroradiology after doing my MD, then I can write that I am a neuroradiologist. So this is how it works.
And how long is the duration of this fellowship?
So fellowship can be of 1 to 2 years, depending from branch to branch and university to university, but minimum 1 year.
All right. So this is how you get trained or specialized in a particular subspecialty of radiology. So it starts from MBBS, then MD in radiology, and then finally fellowship. If you
Exactly.
want to, so is fellowship mandatory or
No, fellowship is not mandatory. It is totally optional. Okay. As I told you, in my time there were not many options, so I did senior residency, but I didn't do a fellowship. Okay. Nowadays the trend is changing. Nowadays medicine is moving more towards subspecialization, okay, including radiology. So nowadays the trend, especially if you want to work in bigger hospitals, okay, then they would prefer subspecialists. But as I told you, it's not mandatory. General radiologists are also working and they are not regretting it. So basically, pros and cons of being both. Pros and cons of being a general radiologist, pros and cons of being a subspecialty radiologist.
So perhaps your career prospects become better after doing a fellowship or after doing a subspecialty in radiology, because, like you said, more and more hospitals demand for that.
Yeah. So first of all, it all depends what are you planning after your radiology. Are you planning to start up your own practice? Are you planning to work in a dedicated tertiary care hospital? Are you planning for research and academic? It all depends what are you looking for? What motivates you? Okay. So yes, if you want to go into research and academic, or you want to work in a tertiary care hospital, then yes, subspecialty would be definitely a requirement. Okay. But if you want to work in a big general hospital, they would prefer more of general radiologists who can do everything. Okay. Or if you want to start your own practice, then it would be better that you are working as a general radiologist where you can deal with all these things. Because as I told you, if you are subspecialized in one thing, that is a specialty, the other thing you might not be that great. So it all depends what is your future plan.
You have practiced radiology in UAE for almost like 9 long years.
Yeah.
So, for the benefit of our audience, can you please, divulge the details about how does one get to practice radiology in UAE? Are there any specific educational qualifications required? Any prerequisites of the program? Any particular certificate training required? What is the process like?
Yeah. So when I completed my MD radiology in India in 2003 and I moved to UAE in 2009. Before that I was working in Delhi. So requirements is, yes, obviously you need to be a radiologist, you need to have a degree in that. Plus what happens is, so for example, I was working in Abu Dhabi. So Abu Dhabi is controlled by HAD, Health Authority of Abu Dhabi. So you have to give an exam of HAD. Okay. Now, luckily, they have opened centers for this exam in India as well. Earlier, there were not any centers in India. You had to go to UAE. But now I have been told that they have opened centers in India. Similarly, Dubai, if you want to go to Dubai, so it is governed by DHA, Dubai Health Authority. So you have to give their exam. Again, their centers have also opened up in India. This is what I've been told. So first, you need to clear this exam. Once you have cleared this exam and you have got a registration number of HAD or DHA, then you apply for jobs in UAE. Okay. So there are websites, or if you directly apply to the hospitals, to their, they can add you to the CV. Whenever there's a vacancy, they can contact you. So basically, you have to first clear their exam, which is a hard license or DHA license. That is what they call. You should have a DHA or hard license to work in UAE. This is how it works.
And how difficult it is to crack this examination? How much do you have to prepare for it?
If you are working regularly and you're working in a good setup where you're dealing with all different type of cases, it shouldn't be very hard. Okay. But if you are only working in one particular field, or you're not working where you have a lot of exposure to different types of diseases and all the modalities, then yes, it might be a bit tricky or difficult. But like, fortunately, I was working in a big hospital where we were exposed to almost all imaging modalities, all different pathologies. So it was relatively, I would say, easy.
So, would you say that work experience is mandatory or good to have before appearing for this kind of an examination?
Definitely, definitely. Because medicine is one thing, not only radiology, medicine in general. This is one branch where experience teaches you a lot. Okay. You might do MBBS or MD from the best university of the world. still something you learn only by experience. Okay. The advantage of getting trained in India is because India has such a massive population. We have so much of patient load. So the number of patients that we see on a daily basis, that is so much, that empowers you with a lot of knowledge. So that is definitely a big boon to Indian doctors who are trained in India, because you have seen so many patients on a daily basis. You get that knowledge which students from other countries might not get in that period of time. Okay. So experience definitely matters. Even if you apply outside, for example, if you apply to UAE, if there are two CVs and one both have done the same qualifications, but one has a more years of experience, definitely he or she would get a preference. So experience does matter.
And this is the only examination that you need to appear for. And once you clear this examination, you get the registration number that you mentioned of, you are good to go and practice radiology in UAE as well.
Yeah, so
Uh,
you can't directly go and start your practice. You need to be employed, so you need to have a job offer. Okay. But
yeah, so
yes,
what I meant is you can be employed. You can be
exactly.
employed after getting the registration number.
Exactly.
Okay. And there is no other prerequisite,
Not for UAE. Not for UAE.
not for UAE.
So
And how
whatever
was your
branch
experience?
you're, sorry. So
Yeah,
whatever,
no,
for
please.
example, if you are applying as a radiologist, if you're applying for a job of a radiologist, definitely you should be a radiologist. You should have a proper degree in radiology. If you have a fellowship, even better, that adds to your CV. Okay. And if you have a work experience from a good hospital, a good center, all these things will add up to your CV. And if there's a vacancy, obviously, if there's a vacancy, there'll be a lot of applications. You won't be the only one who's applying. So to stand out of that list, you will have this. And yeah, one more thing. Them, for example, what happened with me is they do like a telephonic or video interview. Okay, so one is that you are getting shortlisted, and then they do an interview, which could be a telephonic interview or a video call interview, and then finally, if they like you are given the offer.
So, how was your experience like working in UAE in comparison to India? I mean, barring the remuneration, which is definitely more lucrative,
I
but
mean,
apart from that,
definitely that time, yeah, it, yeah. We, to be honest, I went for a greener pasture. Won't deny that. So, but things have changed from that time to this time. But the main, I would say, plus point what happened for me was when I was practicing in India, all my colleagues, not only in radiology but in the hospital, they all were Indians. Okay. When I stepped out of India and when I was in UAE, so we had colleagues from US, from UK, from Europe, from Australia, from Asia, from all over the world. Okay. When you go out first time, at least I was having this apprehension, where would I stand? I'm from India. There are doctors from US, UK. So obviously you have this apprehension. Do you stand a chance in front of them? All this thing. But once you start working with them, then you realize, no, India knowledge is very good. India teaching undoubtedly is very good. Today, whatever I am is because of my knowledge which I gained from India. Okay. That gives a lot of confidence. Okay. So was from a professional point of view, now you are interacting with different people. You learn something from them as well. They learn something from you. But then you realize that it's everything, it's almost the same. If you are good in your subject, no matter where you work, you can easily work. Okay. So that gives a lot of confidence. Plus, on a personal thing, yes, now you are interacting with people with different nationalities. Obviously, when I was in India, I don't think I had any other friend other than Indian. But now you have friends from other nationalities. You learn about their culture, about their religion. So from a personal point of view, it was very gratifying to me. So I loved it. And that's the reason I stayed there for almost 9 years. The hospital was very good. It was a tertiary care hospital. So we were exposed to all different imaging modalities, different subspecialties. We used to have complex cases as well. Okay. Then we had a residency program, which is a PG program. So we were teaching as well. So for me, it was an excellent experience. And when I was working in UE, that is the time I thought, okay, let's add something to my CV for my personal growth. So that is the time I applied for this FRCR examination, which is a fellowship of Royal College of Radiology. To be honest, that time I had no intentions to moving to UK. It was just to add
We'll
a
come
feather.
to that. We'll
Yeah,
come to a UK experience as
yeah.
well. But
So I just gave that to add a feather in my cap, not to come to UK, but yeah, it helped me a lot.
it's very encouraging to know that Indian education is so much at par with the education provided abroad, because like you said,
100%.
you were able to walk shoulder to shoulder with doctors from other countries as developed as US, Canada, Australia, etc. So that's a very encouraging thing to know,
No,
especially for
definitely,
students.
definitely. Today, whatever I am, my basic education foundation is from India. Okay. So if that was not strong, I couldn't have survived outside India. Okay. And the biggest advantage, as told you, is because of so much of workload in India, you see so many of patients. This is the experience that helps you in your later life.
Correct. Now, moving on to your UK experience, you are currently working in UK, and you had mentioned that you are actually now working as a substantive consultant. Am I pronouncing it correctly?
Yeah, substantive. Yeah, that's right. So
Okay.
what substantive means
And
permanent.
you had started working as a yeah, permanent. And you had started working as a locum consultant, which is on the annual contract basis. But after completing your CESR application, you joined the same hospital, which is United Lincolnshire Teaching Hospital, as a substantive consultant, which is like a permanent post. So,
Yes.
how has this journey been like? How difficult was it to keep evolving, keep upgrading your skills, and prove yourself over and over again from India to UAE and now to UK?
Yeah. So in 2017, so I moved to UAE in 2009. In 2017, I moved to UK. Since I had done FRCR earlier for totally different reason, that helped me out. So because I had FRCR degree, so I had a degree of radiology of UK. Okay, I didn't have to go through a complete course. I just needed to give the exams. Okay, which I was giving, and once I got the degree, so again, if you have to work in UK, you have to have a license number, like a registration number. So in UK, it is the GMC, General Medical Council. So anyone who wants to work in UK as a doctor, irrespective of branch, specialty, every person has to be registered in the GMC. Okay. So before moving to UK from UAE, I applied for my GMC registration, which is pretty straightforward. If you have all your qualifications, they just need all the documents which are
Doctor,
authenticated.
if I can interrupt you, can
So,
you take us back to FRCR first?
okay.
What is FRCR?
So FRCR stands for Fellowship of Royal College of Radiology. Okay, so which is equivalent to like MD in MD radiology in India. In UK, it is called FRCR. Okay, so since I had already done my MD in radiology, I didn't have to undergo the whole physical training. So in UK, there is an option. If you are a radiologist, you can just sit for the exams. Okay, there were three exams. What they call is Module One, Module 2A, and 2B. That time, I mean, I'm talking about 2012, 2014. That time, the centers were only in UK, and there were only two other centers outside UK. One was Hong Kong, one was Singapore. So I used to go to Singapore.
Wow.
Okay. So I went to Singapore, cleared my part one, then again went up next year to Singapore for part 2A, cleared those all modules. It had six modules, now it has changed. And then last is a practical, which is part 2B. Again, after 1 year, I went to Singapore and did that. So once you have cleared all these modules, then you have qualified FRCR and you get a
So,
degree.
how long did you take to finish these modules?
So to me, from start to end, it took 4 years. But the reason for that was you don't get the dates. It's not that I was failing or I was not studying to get, because so many students are applying for this examination all over the world, especially from countries like Asia and Africa. Okay. So it's very difficult to get a date. So for example, part 1 and part 2A, the dates were easily available. You struggle for dates for the practical examination, because for practical, if you're giving a theory, you just need a computer, you need to go to the center and you give it. But for practical, they have to arrange the examiners. They can't handle more than particular number of students in a day. So that goes a long waiting. So to get that date for the 2B, I had to wait for almost 2 years. So yeah, from start to end, it took me 4 years. So I started in 2010 and I completed my first year in 2014.
And you studied on your own. There is no there's no coaching, or there is no online classes that are required to be
For
taken alongside your work.
for FRCR, that time again, before 10, 15 years back, online coaching was not that common. Plus, I'm still not aware. I mean, yes, now there are few courses, but basically there are few books which we were told and which I also read. So basically, yeah, you go through those books. One thing is, if you're already in practice, okay, and you are dealing with all different type of cases, that helps you a lot, because then you are just doing a revision. You're not, because it is not something new. It is all about radiology. Okay. So since I was working in Sheikh Khalifa, which is a multi-care tertiary care hospital, I was seeing all different type of cases. I had seen those cases. So if you have seen something, you don't forget them. If you read something, you can forget that. If you have seen a patient, you don't forget it. So
So
again, the
true.
same thing, your experience helps you a
Hmm.
lot. So because my experience of 10 years of radiology that time, plus yes, I prepared for this. I was going through the books and mock questions and everything. So yeah, that helped me, and yeah, I could finally clear the
And
exam.
I need one clarity. You said that if you have done MD in radiology, then you don't need to appear for the entire uh, course of FRCR.
So in UK, for example, so that will take us to another part of discussion. So if you want to work in UK as a radiologist, so there are two options. One, you finish your first, so for example, if you have done MBBS from India, then you have to come to UK, and to start working as a doctor, you first need to give a exam which is called PLAB, PLAB. It stands for Professional Linguistic Assessment Board Test. Okay, it's like for US, if you want to go to US, you have to give US MLE. Similarly, for UK, if you want to move to UK, and you have just done MBBS, you have to first give a PLAB test. Okay. Once you have cleared the PLAB test, which is again of two modules, one is a theory, other is a practical, then you can register yourself in GMC. So PLAB is required if you have only done MBBS from India and you want to start working in UK. To get the GMC registration, you need to clear this PLAB test. Once you have cleared PLAB, you have registered in GMC, you have got a license number, you can come to UK. Again, you have to apply for jobs. You won't directly get a job in radiology. You have to apply for fellowship, observership, or junior doctor post. Once you are into the system, then there are certain tick boxes to be done, because here in UK, in India, to get into radiology from medicine, from MBBS, is you just give examination, competition. If you get the rank, you are in, you choose it. In UK, it doesn't work like that. In UK, how it works is you have to give a competition, but then there's an interview, and then they check what have you done in the field of radiology. How do we know you can be a good radiologist? So
Okay.
you have to done audits. You have to do publications in radiology. You have to show your keen interest in radiology. This is how it differs from India. So that takes a bit of time. It's not very easy to enter into that. That will easily take 1 or 2 years. But once you have got all the tick boxes, then you apply for the radiology residency program. And this is one way. Okay. The other way was through which I came. So because I had already done MD radiology, I didn't need to go through this physical residency program. I just needed to have the exams. I gave the exams, I got the degree, on the basis of which I applied for GMC registration, and I applied for a job here, and I got a job of locum consultant radiologist. So which means it's a temporary job. You're on a contract basis. It's not a permanent job.
I mean, it is just so amazing to hear how you have been continuously learning and working on yourself, and you had the courage to move out of your comfort zone. I'm sure, like, how you mentioned you were so settled in UAE, but still, you kept pushing yourself to grow and evolve and become a better version of yourself, and that is just commendable. That is just so much commendable.
Thank you for that. I mean, yeah, I won't deny that, but there are other colleagues also who are doing that. So that if there are other two or three people who are doing the same thing, that gives you a lot of motivation. Okay, because sometimes you would think, should I really need to do this? I'm well settled. Why should I do all this thing? But then, yeah, if you see people are supporting you, they are encouraging you, they are also doing that thing. So that gives you a bit of motivation, definitely.
So did you get that kind of an environment in UAE where you saw a lot of people?
Yeah, so my other colleagues who are also from India, luckily, they were also planning to do the same thing. So, like you can say, we were doing collectively. So
Hmm,
that helped me a lot.
okay. So, Dr. Nitin Aaron, can you please throw some light on how different is radiology training in India versus UK?
Yeah. So in India, the radiology training or the MD radiology is of 3 years. Okay. So it's a 3-year course. And after that, as I mentioned earlier, it's optional for you, which nowadays almost everyone does. They would go for a fellowship or a senior residency. But the course per se is only of 3 years. Whereas in UK, the radiology course or the FRCR is of at least 5 years. So the basic core training is of 5 years. How it works here is the first 3 years is proper general radiology training, and then the 2 years is of one or two specialties which suits you, which interests you. Okay, but a minimum requirement is a 5 year training. And then in UK, what happens is once you have done this 5 years of radiology training or FSCR, almost everyone goes for a dedicated fellowship of 1 or 2 years. So if you, some people go just for fellowship of one subspecialty, some people go for fellowship of two subspecialties. So if you're going for one subspecialty, you need another 1 more year of training. If you're going for like two, then you need 2 more years of training. So that is the basic difference. 3 years in India, 5 years in UK.
Yeah, so the duration of completing your radiology education in UK is a bit longer than India.
Yeah. So the MBBS is also longer in UK. I mean, if you're doing MBBS from UK. So in India, we have 4.5 years of medicine and 1 year of internship. So it's a 5.5 year. In UK, most of the colleges it's 5 year. Some colleges is 6 years. They ask students to do a BSc as well. And the internship, what we call in India of 1 year, in UK it's called foundation, and that's of 2 years. So in
Okay.
UK, the minimum MBBS, including foundation or internship, is 7 years, whereas in India, it's 5.5 years. And talking about radiology, in India, it's minimum 3 years. In UK, it's minimum 5 years.
So you do 7 or 7.5 years first, and then 5 years later. I mean, 5 years more. So 7 plus 5, 12 years to actually become a
And almost,
radiologist.
as I told you, almost everyone would end up doing a fellowship as well. So we get trainees every year to completely pass out as a radiologist with fellowship. You're looking at the age of almost 32, 33. But then you are full ready to become and act as a consultant. Okay, because you have undergone such massive training of so many years. So you are now all set to become and work like a consultant. But yes, by the time, assumingly everything goes in one straight way, no gaps, medicine, radiology, FRCR, and if you're doing a fellowship, yeah, at least 31 or 32 years by the time you start working as a consultant.
So it requires a lot of commitment from your side. You need to
Oh,
be
yes.
totally
Yes.
committed to this field.
You have to be absolutely clear that I want to do medicine, I want to do this thing, because yes, you would see your colleagues who have done engineering or anything working at the age of 25, 26, and you're still studying. So yeah, that requires a lot of motivation, perseverance.
But would you say that it does it make more sense to do your MBBS from India, therefore, because it is shorter than pursuing MBBS from UK, and then perhaps after completing MBBS from India, uh, if you want a global exposure, you can try for FRCR in UK.
That is an option. The problem is if you have done MBBS from India and you apply and then you want to come to UK and apply for radiology, you would be considered an international candidate. The seats for international candidates are much less.
Okay.
If you come from India and do MBBS here, then you are a so when you apply for residency, then you are a local candidate.
Okay.
Okay. So obviously the seats for international candidates are very less. Again, to get admission into MBBS is not also that easy because again, you will be when you apply from India to UK for MBBS, you still will be an international candidate. Okay, so again, it's tough. It's not very easy because majority of the seats are reserved for the local candidates, the students who are studying in UK. Okay, but if you are lucky enough and you enter into MBBS in UK, and once you are in the system, you have done MBBS from UK, and when you apply for residency, then you are as equivalent to any other local UK candidate because now you're a local
So,
candidate.
acceptance rate of getting through an MBBS course in UK will be higher than the acceptance percentage of getting through directly in FRCR.
Exactly, because of the number of seats. Because the number of seats for MBBS are much more than the number of seats for radiology.
Yeah. And you also said that, if you complete your MBBS from UK and then move on to do FRCR, you will not be treated as an international student then.
Yeah. So now you are a local candidate because you have done MBBS from UK. So
All
you
right.
are at par with all other candidates.
And therefore, it does make sense to do your MBBS then from UK. If you have any, if you're thinking of doing an FRCR from UK, then it makes much more sense also to do your MBBS from
Yeah.
UK.
But let's not forget the fact that if you're planning to do MBBS from UK, you're looking at another big expense because
Financially, yes.
financially,
Yes,
because
yes.
that is a big factor.
Yeah,
Because the cost of doing MBBS, I mean, obviously you are coming as an international student. Okay.
correct. And of
And that
course,
too at an age of 18 or 19. Many parents might not be very comfortable.
right, right.
So yeah, I mean there are multiple factors which have to be taken into consideration. But yes, if we strictly talk about ease of getting into FRCR, yes, if you have done MBBS from UK, it's much easier to get into FR radiology training if you have done MBBS from here as compared to if you have done MBBS from India.
Right, right. And even UAE has a longer duration for pursuing MBBS in comparison to India, or is it at par with India
UAE, if I'm not wrong, it is almost the same. It's almost the same
as
as
India?
India. As India.
Would it be possible for you? I mean, if you even remember it now, some of these sought after colleges, one can look for in radiology in UK, in UAE, and in India. I mean, any top of the mind recall?
See, so any university, be it India, be it UAE, be it UK, which is renowned for its MBBS, by default, their PG would also be very good because there'll be proper teaching hospitals affiliated with big hospitals, government hospitals. Okay. So if a medical university is good for its MBBS, I don't see any reason why it won't be good for its residency program as well. So talk about like for example, India, AIMS, JIPMER, Pondicherry, AFMC Pune, Bombay Hospital. I mean, all these hospitals, big universities, they all are excellent. They all are excellent. Similarly in UAE, similarly in UK. Any university, for example, I mean, if you talk about UK, Oxford, Cambridge, University College London, King's College London, Imperial, all these are very good universities. Okay. So there might be a bit of plus minus, but all are very good. The teaching here, especially, I've been here now, this is my eighth year. The teaching here is very good.
That's excellent. Apart from radiologist, now another career path in this field is to become a radiology technician or a radiology technologist. Is that the term that is used, radiology technician?
Yeah, so radiographer or radiology technician is the same thing.
Okay.
So
And
that
how,
is,
yeah, what
yeah,
are the main responsibilities of a radiology technician, and how is it different from a radiologist? Like you're saying there's a radiographer and then there is a radiologist. So
yeah.
what's the difference between the two, and what are the main responsibilities of the two? I mean, we already
So
know about radiologist, but
yeah, so a
radiographer.
radiologist is a person, is a doctor who is reading the investigation, radiology investigation performed, but they are not actually doing it. So, for example, we radiologists don't no longer, I mean, long back, yes, but no longer we do x-rays by ourselves. The x-rays are taken by a radiographer or a radiology technician. Similarly, CT scan, MRI scan, we just read them and we report them. We are not performing the scan by ourselves. These scans are being performed by the CT radiographer or the MRI radiographer. Okay, so it's part of radiology, but it's a different thing that radiographers or the radiology technicians or technologists, they are performing the scan. We radiologists are reporting the scan, we are interpreting the scan. That is a basic difference. A radiographer or a radiology technologist doesn't need to do medicine. They don't need to do MBBS. They have a different course, BSc in radiography and all this thing. I'm not 100% sure what are the levels in that, but that is a different course. They don't need to be a MBBS doctor.
Okay. Okay. And would you say that radiology is a well paid profession even in India, or does one still need to look out for opportunities abroad for greener pastures?
In the last, I would say definitely last 10, 15 years, things have drastically improved. Okay. Uh, in early 2000s, I won't say that the radiologists were very well paid, except for the top radiologists, obviously, who had a lot of experience. So yes, they were being paid well. But for junior doctor, the junior radiologists like myself that time, the salaries were decent, not very great. But now whenever I go back, I meet my friends and all this, things over the years have changed. And one factor, as I mentioned, contributing to that salary change is because, as I mentioned, radiologists or radiology has become an integral part of medicine. Every patient, as I told you, will have every second patient will have a laboratory test, blood test, and everything, and they will also have radiology. Some sort of imaging will have. So because there's so much of demand, so that has helped increase the salary structure. So in India now, it's not that, oh, you need to go out. No, in India the salaries now are quite decent.
Yeah. And, adding to that, these days, all around you, you see so many diagnostic centers that have mushroomed, across India. So, how rewarding it is to open or start your own radiology or a diagnostic center, and what are some of the challenges that one can face?
As simple as that. What is your liking and what is your temperament? Okay. I never opened a center. Many of my friends pursued me, why don't you open a center and all this thing. So first of all, your temperament. I didn't have the temperament to basically opening a center is like it's a business. Okay. At the end of the day, it is a business. So if you have that business aptitude, the temperament to do a business, to run a business successfully, then yes. Second thing, I can tell about myself, me as an individual, wanted, and I always wanted to work in a hospital, in a big hospital setup. Okay. Because I wanted to work in a place where I can interact with a lot of people, people of all specialties, do all the investigation which are possible, get feedbacks, especially that was very important. Okay. So I plus work-life balance. If you're a employee, you can still have a work-life balance. If you're in business, I mean, if you have a center, it's like any other thing. You are a business. Okay. So yes, you can recruit people, but at the end of the day, it is your responsibility. It's your business. Okay. Second, the main challenge in radiology is the cost of the machines. So, for example, if you want to open a center, if you want to just put up a X-ray machine or a ultrasound machine, that are still okay. They are not that crazily expensive. But If you want to open a full-fledged center and you're talking about a CT scanner and MRI scanner, you're talking about investment of at least crores. Okay. So, and this is just about the machine. You need the place, you need the running cost, you need people. So finance is one big, yes, people still do that. There are a lot of mortgages available and people have been very successful in that. So again, it all depends on your temperament. But the biggest challenging factor to open a full-fledged center of yours, it would be finance. Because if you want a complete radiology setup, you're looking at a lot of money. Okay. Second thing, as I mentioned, you don't necessarily need to do everything by yourself. You can recruit people, but work life balance, your personal preference, you want to be in a center, you want to be in a hospital, it is all that depends. So it's all individual based. Many people, what I know in India, they do is they work in a hospital, like it's a mixture of both private and employee. They work in a hospital from 9 to 5, and then they have set up put a ultrasound machine of their own at their home, and on the weekends or weekdays after hours they do like 2 3 hours of ultrasound. So that is also one thing which a lot of radiologists do in India. So again, depending on what suits you.
You mentioned about having the right temperament. So, what would you say are the essential skills or an aptitude one must possess if they want to have a successful career in radiology, if they want to sustain this career in the long run? What are those essential skill set and aptitude one needs to acquire?
I would say there is only one main thing which you require, and not only for radiology, for any other branch in medicine. Medicine is a continuously evolving branch, so including radiology. So daily new developments are happening, so you need to be aware of all these changes. So basically you need to keep on studying. Okay, not books but journals, attending workshop, attending conferences, because medicine, radiology, these are continuously evolving fields. Okay, so if you are not keeping yourself aware with the new developments, then you'll be left behind. Okay, so yeah, that is one thing, that don't expect that okay, I've done MD, I've done FRC here, now I don't need to study. No, till you are working as a doctor, you need to continuously keep your knowledge updated, read journals, attend conferences, workshops, and all that. So that is perseverance to this, I think, is the key bit.
So even though you have such a huge, long body of experience behind you, and you are still working in a hospital, you feel the need to continuously update yourself through publications, journals, like you
Definitely. I mean,
mentioned
you
just now.
have to go through them. In fact, in the Western world, I'm not sure about India, but definitely in Western world, there is something called an annual appraisal. Okay, so for example, in UK, I'm working in UK, we our license gets like an annual appraisal. And to do that, you have to show, it's a mandate, okay, that this year I have attended these conferences, I have done this thing. How are you keeping your knowledge up to date? You have to prove that. Okay.
Wow,
So, and plus,
great.
forget one thing is the official thing, which is a part as a appraisal for yourself. Because as I told you, new investigations are coming up, new findings are coming up. If you are not keeping yourself up to date with this knowledge, you no longer would be a good radiologist. In few years, you'll be, oh, he's just a okay radiologist. So, and that is true for all the branches of medicine, be it surgeon, be it medicine, any branch. You have to continuously be involved in reading, learning, teaching, and everything.
So, in present times, radiology can be seen as characterized by a significant advancement in, medical imaging, and there's also a growing reliance on artificial intelligence for image analysis and image interpretation. How much does a radiologist need to keep on evolving, themselves in these emerging trends, and what more can they do apart from being just a radiologist?
Okay. So basically, there are two questions in this. So let me answer the second part, which is what they can do just besides being a radiologist. So obviously, the main role of a radiologist is to interpret the radiology investigations, make a report, which helps in better patient healthcare. But besides that, there are other roles what we as a radiologist doing, especially if you're working in a government hospital attached to teaching medical schools. Okay. So one, yes, besides radiology, one thing which happens is we attend MDTs. MDTs are multidisciplinary team meetings. Okay. They are mainly held for oncology patients, cancer patients. So what happens is, for example, if unfortunately a patient gets diagnosed with cancer, okay, then before the actual treatment starts, we have different MDTs for like lung cancer, brain cancer, and all this thing. Okay, so these patients are discussed in the cancer meetings, MDTs, where, for example, I do lung cancer MDT. So there would be a chest physician, there would be a chest oncologist for the lung cancer only. There'll be a histopathologist, there'll be a surgeon, there'll be a radiologist. So we all sit there, we all discuss that, okay, these are the findings, this is the cancer, this is a staging, this is the patient's clinical condition, comorbidities. So this treatment option would be best suited for this patient. Okay, so we make an integrated approach that what best management would suit this patient. So these are very important nowadays, for especially for cancer patients. Again, this is part of radiology work. Besides that, since I'm working in government hospital, which is attached with a teaching medical school, we have to do on a regular basis teaching not only for the medical students but also for the radiology residents who are doing training in radiology. So we are teaching medical students who are doing MBBS, and we are teaching students who are into radiology residency. Then there is one more thing, especially in the Western world, which is called advanced radiography practitioners. So you mentioned about radiographers or radiology technologists. No longer they are just doing the scans. They are not only performing the scans, but nowadays what's happening, especially in countries like US and UK, if a radiographer has have a good experience of 10, 12 years behind them, they are coming into reporting as well, radiology reporting. Okay. The main reason for that is because there's so much of workload which the radiologists are not able to cope up. So, and they also have a good basic experience. So they are being trained to take up some part of radiology reporting. Okay. So we mentor them as well. Okay. So we are training the radiographers. So that is mentoring. So radiology, MDTs, teaching, mentoring. Then yes, we have to do audits. Okay, which is required for a departmental to see if your department is doing good, if it's meeting the protocols set by the government agencies, or are you at par with the other national, international bodies. So audit is one thing. Again, as a professional thing, you could be involved in research, teaching. So these are all the different aspects which you can do besides being just a typical radiologist. And what was the first part? Sorry, I forgot of your question.
And what are some of the emerging trends and technologies now in this field of radiology and medical imaging?
Yeah. So emerging trends, I would say, are three. The first and the hottest is AI, artificial intelligence. So artificial intelligence is coming a big way in radiology. Yes, a lot of people have apprehension that or later on it might take our jobs. But as of now, what we have seen, I've been a part of two, three projects in this. The results are very good. So right now, what is happening is AI is not signing off a report. Okay. What happens is, for example, if an investigation is done, AI does the first read. That is what we call that they first interpret the examination and they will highlight their findings. But the final read and the signing authority is the radiologist. But how it helps is that at the end of the day, radiologist is a human being. They can have errors. Plus, if you have been working for an 8 hour shift, end of the shift, and it has been a crazy shift, you are tired, you can do mistake. Okay, we are not living in an idealistic world that you won't do mistake. Errors can happen. Okay, if AI has already picked up something and it highlights, it becomes easy for you. So AI definitely is helping out. Plus, for example, if there is a busy hospital which is doing like 1,000 X-rays per day, and you don't have that capacity to get them reported, if AI has done the initial bit, and these all these big companies who have invested in AI. So, for example, I am aware of one such company which they are doing AI in chest X-ray. They have been feeded almost more than 1 lakh of chest X-rays into them. So they have seen more than 1 lakh of access, so they have the knowledge. Okay. And if they have picked up something, then when I go to report, I can see if I agree, fine. If I don't agree, I can change it. So the final signing out authority is me. They just do the first read, which usually pick up a lot of things. Okay. There might be some false positive, but then the onus falls on me to, because I'm the final signing authority, that is that correct or not? Do I agree or not? So I can do the changes, but definitely it helps out. So that is the commonest imaging trend. Second emerging trend in radiology is molecular imaging or nuclear medicine. So till now, radiology has been, yes, we are looking inside the body. We are looking at your lungs, your brain, and everything. But now, in the last 1 decade, it is what we call molecular imaging, that what is happening at the molecular level, which till now we couldn't happen. Okay. It is still an evolving phase, but that is the big thing which will come up in the coming years, molecular imaging, which will transform a lot of things, especially related to cancer cases. Okay. There it plays a big role. Third thing, which has been there and which is continuously progressing, is intervention radiology. So interventional radiology is basically where you use your surgical and radiological skills to treat patients. Earlier, for example, so common examples of interventional radiology is like, for example, you do a CT scan and you see a lesion. You need to confirm whether it's cancer or not. How do you confirm that? You need to put in a needle and take a tissue diagnosis. So under image guidance, we put a needle, we take a tissue diagnosis, we send to the lab confirms it's a cancer. Earlier, long back, you had to patient had to go a minor surgery to take that part out and send it out. Okay. Similarly, there are different fields where, for example, just to give a very simple example, coronary angiography, cardiac patients. Still, they have coronary angiography, but a lot of patients who are not very fit or they don't want that, they instead can go for CT coronary angiography. So radiology is replacing a bit of this. Similarly, intervention radiology, some procedures which earlier needed proper surgical option, they can now go through this minimally invasive procedures and treat the patient. So that avoids your hospital stay, that avoids your big bills, and that is very easy for the patient in terms of recovery. So these, I think, are the three main emerging trends in radiology in the coming future.
I mean, it's just so fantastic to hear all of this. And I'm
Technology,
sure radiology, irrespective of AI or any other advancement in technology, is here to stay in a big way. And like you mentioned, AI is only going to make the job of a radiologist more efficient and
definitely.
not replace it as the apprehension or the negativity or,
See,
uh,
no one knows what will happen after 15, 20 years, but as of now, whatever initial results we have seen, they are quite promising. They are helping you. Okay, because it's a double read and it's basically like two people reading. If two people are reading, the chances of error goes down a lot. Okay.
absolutely.
So it's like that.
Yeah, that's nice. And you've been working as a radiologist for 25 years. So even today, do you enjoy your work as a radiologist?
I love it. I love it. I still love it. And otherwise, I would have left it long back. Okay. There are options of career change, especially once you're out. Okay. But I still love being a radiologist. Two reasons. First, it gives you a lot of happiness when you diagnose something. You are actually a part of patient healthcare. Okay. That is very satisfying. Okay. And especially if you're working in a hospital, you would immediately get a feedback. For example, a patient gets a scan done and you suspect something complicated which requires surgery. You discuss with the surgeon. You tell the surgeon, this is what I think. I think this patient needs to go to the OT and please give me the feedback. And nothing can be more gratifying. And then after 4 hours, the surgeon comes. We open the patient and it was exactly the same finding. Patient is now fine. That is so satisfying. Okay. Second thing, radiology, big demand nowadays among the fresh medical students because it's a very good branch for work-life balance. Surgical
Okay.
branches, yes, they are high-paying jobs, but the work-life balance gets a bit diluted. Okay, because in radiology, at least as of now, you have a good work-life balance.
So, what are
So
your working hours like, in your current hospital?
So it's 40 hours per week. So basically, I work Monday to Friday, 9 to 5. Okay. But then, because, yeah, we are in a hospital setup, we are a 24/7 industry. So we have night on calls, evening on calls, weekend on calls by rotation. So it's all by
Okay.
rotation. But normally, yes, if I'm talking about a straight, it's a 40 hours, 8 hours job per day. And then you're free unless you're not on call. But again, on call is also on rotation basis.
Okay. And I mean, finally, I'll just ask you one last question before we end this podcast. If there was any advice that you had to give to the students who are aspiring to pursue, the career in radiology, what would that advice be?
Just one advice: enter into radiology if radiology excites you. Don't enter into radiology thinking of the pros and cons. So in India, we have internship after medicine. That the whole idea of doing internship in which you're rotated in all different uh, surgical branches, medical branches, radiology, everything. The basic concept is that see what interests you out. Okay. So follow radiology or take up radiology only if you are keen to become a radiologist, if radiology excites you. Don't just take up, oh, it's a good work-life balance, or maybe there's more money and all this thing. No. If radiology doesn't excite you, I would say think twice. But if you are passionate about radiology, definitely come into it.
And the students don't need to become so fearful of AI taking away the radiologist or the radiographer's job, because
I
there's a
don't think
lot
so
of.
because see, at the end of the day, you need a person. Okay, you need a patient needs to talk to a radiologist, to a doctor. Other colleagues also they need to talk to a doctor. Okay, there might be some job cutting. These are all presumptions. No one knows the future. Okay, but definitely you need a person whom you can talk. Okay, because as I told you, AI, we still have some false positive, some false negative. So AI is not like completely 100% right. Okay, so you still need radiologists, and AI is not a cheap thing. It is a costly system. So it all depends that can every place, every institute, every hospital can afford AI or not. So there are a lot of factors. It's not that, oh, you just put AI and you replace a radiologist. Definitely not. You still, at the end of the day, if you are running a hospital, you need radiologists.
Thank you so much for clarifying this. And thank you so much for taking out your valuable time for this podcast. We greatly appreciate your time and expertise. I'm sure this podcast will act as a beacon of light for so many aspiring students and aspiring radiologists out there, and it will steer them in the right direction and will help them make an informed career choice. Thank you so much once again, Dr. Nitin Aaron, for being here with us from UK to conduct this podcast with us. It means a lot.
Thank you so much for having me on your show. And I just hope that I could be of any help to all the students who are planning to take up radiology in India, especially.
I'm sure you were of immense help.
Thank you.
And you were listening to No Herd Mentality Career Conversations. Please subscribe to our channel for more such in-depth conversations on different careers. I am Ruchika signing off on behalf of No Herd Mentality. Thank you.